High Tea with Grace, where we spill the tea on HIT. I'm thrilled to be here at the Health Conference, learning about the industry's greatest trends in a very, very challenging and tricky time in healthcare. So tell me, who are you and what do you do in the space?
Kristen, I am the founder and CEO of b.well Connected Health, and we are a SaaS platform that helps payers, providers, health systems, retail pharmacies, and big tech companies, all with their consumer-facing experiences.
Fantastic. So what is the most underrated or underthought about challenge in healthcare right now?
Oh, there's a number of challenges in healthcare right now, but I would say from an underrated perspective, there's still a lot, in our space at least, interoperability. There's still a lot of debate. Is it solved? Is it not solved? What is this new health tech ecosystem, and is the data really flowing? And I would say that there's a lot of drama associated with the conversation around that, but what I'm here to tell you and I'm so excited is that the data is actually flowing. So we have been able to take individuals, something that we started the company about 10 years ago. We can collect the majority of their longitudinal record in under 2 minutes. So
Wow.
we're really excited about that. And then consumers, of course, as you know, can then consent to share that information to companies who can add value on top of that data, not just the data itself. So they can finally get more convenient, simplified experiences that they need.
Finally, an empowered patient.
Yes.
You and I both know that's what we all want. We're
Yes.
craving it. Give us that data and make it easy to access, right? So tell me, what trends are you hearing in the health hallways?
Well, of course, you can't go anywhere without talking about AI. And I think that the conversation is right where it should be in the hype cycle of AI, which is transparency and safety and policy. And are there going to be standards, whether they are state-based like California, or are there going to be standards committees that raise up, and what is the government going to do? So we're watching very closely. I mean, obviously Chai was an early entrant, having a little drama there with the federal government, but UREC now has an accreditation. Obviously NIST is something that we've all followed for a very long time. So for us, we're thinking about it from the consumer perspective. So we just architected something that we call the Patient Bill of Rights for AI that we're adopting as a best practice and that we're going to try to bring to organizations like the Caring Alliance and other consumer-focused organizations to see if we can't get those things adopted as best practices.
Fantastic. I actually just posted that on my Instagram, so check that out, y'all. Last question. My listeners love to hear about what's going on in the industry, but they also love to learn from leaders in the space about what drives them. So tell me, if you could give your younger self a piece of advice, what would you tell her?
Oh gosh, I would tell her to be more patient, that everything in healthcare takes a lot longer than you think that it should, but to stay the course. Because I tell people, anything you're building new in healthcare, it's like roller skating uphill carrying a boulder. And so you do make a little bit of progress, and then sometimes you get a little tired and you fall back down a little. But I would definitely tell myself, keep going because it's worth it. And when the adoption hits, you can see all of the impact that actually brings to, in our case, patients and caregivers.
Thanks for joining me today, and thanks for having tea with me.
Yes, thanks for having me. It's good to see you again.